Okay, so this is basic life support, the CPR skills that are tied to the CPR first aid event. Really focusing mostly on Rescuer 2, because Rescuer 2, you're the one who initiates CPR. You're going to need to know how to do CPR solo as well as two-person CPR. Rescuer 1, remember, is always going to go to that first aid patient first, deal with that, and then come and be a second rescuer in the CPR scenario. So they'll do two rescuer CPR. I already did skill videos for skill 6 and 7. I would highly recommend watching those first because that's where I spend more time on the technique of what things look like. Because in this one, I'm doing skill 8 and 9. And in this one, the AED is available. So everything else stays the same as far as my technique on how to check for responsiveness of my patient, my PPE, all of those things, right? The only things that change is that when I initiate and call for help and activate the emergency response system, an AED is available, okay? So watch that other video first for how all those steps look if you don't know CPR well. That's where I would start. I also explain, my mannequin that we use here in Billings. The 2022 conference is going to be in Billings as of right now. 2021, remember, we're going virtual. I'll talk more about what that's going to look like for the video that you would be required to submit. You don't have to have a mannequin for that video. It might be nice, but we'll find workarounds depending on what's available at your school and or at your home if you're working from home, because we know that this typically is equipment that would be provided by Montana HOSA and not something that you would need to bring in. So we'll work with you on those things. If you have troubles when you're doing this, reach out. But in this scenario, I would have been doing CPR. As Rescuer 2, I would have found that my patient was in need of CPR because they weren't breathing normally or they weren't breathing and they had no pulse. So I'm going to do CPR. The AED is available, but I don't get it yet. I don't get it until my other rescuer comes back to help me and they show up with that AED. Okay. So with that, I'm going to continue doing CPR while Rescuer 1 needs to know how to work this. So Rescuer 1, you want to make sure that you're looking at your rubric for this as skill 9. But you're going to show up with this AED. This, again, is provided by Montana HOSA. You could, I think, bring your own. I'll double check the guidelines on that as we move into 2022. Remember, right now we're working under the old BLS guidelines from American Heart Association. Those are changing this winter. So if anything's changing in them with regards to this, we would see that next year. But the first thing that you always do with any AED, whether you're familiar or not with it, is turn it on and it's going to walk you through it. So these are the ones that we're using in Billings if the conference were to be here. And so I'll just walk this up for you. This one has a green on button, and that's always where you're going to want to start it. I'll tell you exactly how to work this thing. Some, to turn them on, you just lift the cover and it would turn on and start talking to you. So just know that we always want to turn it on, and then it'll lead you through the next steps. For example, this thing's going to tell you to pull out the pads and connect them onto the body. So these pads are already connected to my AED. Some, it will tell you to plug in the pads connector, and that would have a plug on it, and you'd see a spot to plug that thing in. Again, it's going to walk you through exactly how to use them, so you don't need to be uncomfortable about depending on where the state conference is and what these AED trainers look like. Remember, this is a trainer, it can't actually shock me. So then this thing has pictures on it, and I open it up, and there's pads on there that are sticky with electrodes. So you can kind of see on these pads, one's going to come up on the chest, and the other one is going to come around the side in this type of a direction. So make sure you place your pads correctly and follow the directions. This one will then tell me that it's analyzing. Some have an analyzing button. Again, it will tell me press the analyze button. Okay, so Rescuer 1, you're bringing the AED and you're working this thing. Rescuer 2, you're still doing compressions. Don't stop doing compressions just because the AED's arrived. Okay, remember, compressions save lives. They keep that tissue viable for that AED to work, and we want to decrease the amount of time of pause between compressions. So I'm going to keep doing my 30 compressions and 2 breaths while they're working those pads around my hand. So I'm not stopping until they tell me to stop. Rescuer 1, you're going to tell them to stop when we're analyzing and we're clearing this thing for your patient. So when it's analyzing, we want to make sure nobody's touching. I like the 2-hand technique, so that I look up at my patient's head and all the way down at their feet. I know these mannequins don't have feet, but I want to get in that habit in case my paramedic, somebody else is getting an IV line or doing something else, that I'm looking and we're clearing that patient and nobody's touching them, so we don't pick up a rhythm and then we get a false reading on whether to shock or not. Okay. Then the AED will do its thing. It will tell you whether it's a shockable rhythm or not. Go ahead and do your own thing. If it asks for a shock, you're going to want to clear again, and it'll tell you to press the flashing shock button. And this one, it's this red button here. Okay, but it'll have one, it'll be flashing, it'll be bright. Again, we want to make sure for safety that we clear. If it says no shock advised, no big deal. That's real life, right? Go ahead and just resume CPR. Once again, your AED, whether you shock or not, will tell you what to do next, such as resume CPR. Okay, so you'll resume CPR in there. This time we're switching. So you put on the AED as rescuer 1, rescuer 2. You were still doing your CPR from the beginning. You're probably smoked now. So once we're doing that and we're hands off, rescuer 2, you should be moving up and getting ready to work your bag valve mask at the head of your patient. In rescuer 1, you're going to move into that side spot and do compressions, just like we did in those earlier scenarios where there was no AED. We're doing that same thing again, right? So we're doing 30 compressions, 2 breaths with the bag valve mask. We're doing that for 2 minutes, and that's when we would normally switch. Your AED is going to want to analyze again during that time. Awesome, same thing. Run it properly. Do your safety of checking for clearing your patient, doing that kind of thing. We'll do another round of CPR as far as 30 compressions and 2 breaths in that new position. Again, checking that the other rescuer 1 can work the bag valve mask. And at that point, they'll tell you that EMS has arrived. So the thing that's really different about this is just that this scenario has an AED. Make sure you feel comfortable using them and the steps that belong to them. And that's about it.